August Health and Human Services Committee meeting to order. Is Bob Gibson on?
I am.
How are you, Bob?
Doing well, Supervisor. Thank you.
Why don't you're up, so why don't you go, Bob?
Thank you. I have 5 requests before the committee. I'll read them one by one. Number 1, there's a request for authorization for the chairman to enter into an agreement with Northern Rivers. Northern Rivers Family of Services provide preventive respite services for us. That's essentially for a lot of our preventive cases. Sometimes it's a good thing if, you know, just for a weekend or for a few days, we are able to find a safe place, a nice home. When we're working through some family issues, it sort of gives a little bit of break, particularly if some emotions are running high. And we've been contracting with these folks and other agencies like that for these services for years. So that's what that would be for.
Are there any questions from the committee?
I'll make a motion.
Second?
I'll second.
All in favor?
Pat.
Aye.
Aye. Opposed? So carried.
Okay, number 2, I have a request for the chairman to enter into an agreement with Berkshire Farm Center for the home run program. And for those not familiar with that, I'll just give a quick rundown, but that's for young, either preteen or early teens, in their, you know, they might be engaged in behavior that's considered pre-PINS behavior, PINS being persons in need of supervision. Often it's, you know, you start to catch it with truancy or incorrigibility. But by and large, it's seen within the school setting, and the school works local probation department. It works with our department. So we hire sort of an intermediary to sort of be in the school, catch that sort of behavior early. They start to work with the youth directly in the school, but they also then open up a file on family, and they spend a couple of days a week, a month out at the family residence as well, all designed to sort of find the reason for the truancy and whatever other behaviors that are coming up, to see if maybe we can't intervene before it's necessary to start court proceedings for PINs, and certainly trying to ward off any JD behavior that might come. And again, it's a big county and local district partnership, and it's had some success in the last couple of years. So we really want to start to, in keeping with our preventive model, sort of see what we can do about building that up and taking some of the other numbers for court-related appearances down.
I will support that. I'll move it. Yuri.
I have a question.
Go ahead, Linda.
So who invites this group into the school?
So it's got to be a school district and county partnership. And the schools always set aside the room. They will often set aside the space for them to work with. You know, it's just got to be an appropriate space so that the child can work with these specialists to start talking about it and build up a rapport. The family has to be on board, and the family has to be willing to work and, you know, kind of talk about the issues and see if maybe it's something within the familial patterns that might be causing some of the issues, and they have to be willing to work that out as well.
But I'm a little confused. Why is probation part of this? That's if it's
well, probation may be part of it. It may not be part of it because probation is often brought in pre-pins as well. And so probation might want to make this kind of recommendation because they don't feel there's a need to go forward with a formal PINS proceeding if there's enough work being done with the family. It's just another portal to get this in. The important part is that it is pre-PINS, so it is court intervention, but it doesn't mean probation would be out of the picture altogether, because often they try to divert things so that they don't become PINS.
I guess I've never heard of probation before PINS. That's what confuses me.
Yeah, no, and I could understand that. And, sometimes you want to sit with Vince Dodo and we could get into that a little bit more, but, they're also in a preventive posture as well, because they're trying to, they clearly don't want to open a PINS, and they certainly don't want anything progressing that may lead towards a JD. So if they're able to do something, pre-PINS, they're certainly in it. But more likely than not, this is going to be a school district reaching out, saying, we're having these truancy problems. We think there needs to be a preventive program in place, and then we start to discuss getting the home run program put into place.
Oh, last question. I know there's a lot to do. So it's
okay.
The request is to you. Am I correct?
I'm sorry, say again.
Is the request to you? Does it?
Well, yeah. So obviously, it's going to run through our offices as far as we're making. The school sort of contacts us, and then we will make the recommendation to what program. And if it's home run, then that's why this contract is in place, so we can make the referral to the home run program.
Okay, thanks.
Could I follow up, Commissioner, with a question, please?
Of course.
I don't remember this program being around even a few years ago. How new is this?
It's probably going to be in its third year coming up.
Okay, because I can tell you that school districts in the past have had to go straight from guidance counselor to PINS. Okay, so this is another platform for families to avail themselves of to see if we could avoid the trouble, the expense, and the stigma of a PINS and all that it entails.
Yeah, it certainly is that, and it's in keeping. We've got other preventive programs in schools settings now as well, including sometimes sending our own preventive workers out there for exactly that reason, to sort of establish the relationship with the school. It's all designed, if you can keep a PINS from having to be formally filed, it's just like not having to file a neglect petition against a family. It's just it's pre-neglect, you're just going to get more of a sense of, hey, we want to avoid this too, so how can we work together to do that?
Any other questions? We have a first from Beery. Do we have a second?
I'll second it, Morel.
Second, Morel. All in favor? Aye.
Aye.
Opposed? So carried. Thank you, Bob.
Thank you. The third is I'm requesting authorization to amend an agreement I have with St. Catherine's Center for Children and to include case management services out at the Galvic Civic Motel. Chairman Lagonia, and I think Chairman Morel, I've been looking very closely at this program over the last few months. And sort of want to bring in a little more of a professional feel. I've been in talks with Jeff Rovitz over at the MHA, and they really felt like their strong suit is care coordination, but not sort of running a shelter-like program in toto. So we just began to have that conversation with St. Catherine's, who we contract with as home finders now. They run the Marillac shelter up in Albany. So, I thought, well, that might be a good way to sort of we've had successes out at Galvin, but it's not been up to the standards that I'd like it to be. It wasn't all on any one particular point. It wasn't all on MHA. It wasn't all on my staff. It wasn't all on Galvin. It was probably a mix around. And so bringing in these professional level services seemed like a way to boost this program. Galvin, I've got meetings set up with them because I think there's things that have to be improved from that perspective as well. So this is, over the course of the next 30 days, I'm trying to turn things over so that we can up the standards out there. And part of doing that was bringing St. Catherine's in. So that's why I'm asking to amend their contract.
And Bob, Matt and I met with you. I just want to inform the committee to also try to expedite this. Supervisor Mussman had reached out to me in reference to this as well. And I had asked you to set up a meeting to see if we couldn't push this along a little bit. So I don't know where we're at with that, but I did want the committee to know that we are working on this.
Well, and I haven't seen, from that perspective, I think we need to, like you said, go forward with that as well, because there's some things from the facilities end of it that the standards aren't up to where they should be as well. And I see that hopefully working in conjunction with the programming that I'm changing around, so that, we can raise the standards from all levels.
Okay. Are there any questions on this? If not, I'll entertain a motion.
I'll move it, Buray.
Patsy, second.
Kathy, second. All in favor?
Aye.
Opposed? So carried.
Number 4 is a request of the chairman to renew an agreement with Berkshire Farm for the recruitment and retention of foster care families. That's an ongoing, as you know, it's an ongoing endeavor that never stops. They've been one of our recruiters, along with also St. Catherine's does some recruitment for us. And it's just a job that's never done.
Any questions? I'll entertain a motion.
I'll make the motion.
Motion, Mussman, second.
Sterling.
Sterling, all in favor?
Aye.
Aye.
So carried. Is that it, Bob?
No, one more to go, and I appreciate your patience on this. The last thing we need to discuss is a request that I've made to the board to do an appropriations funds transfer. That's essentially just moving money from one line in my budget to another, and more specifically from the building maintenance account into the supplies for janitorial accounts. We just spent a lot more on janitorial once COVID came around, and I did less actual construction because I had much fewer people coming in on a day-to-day basis, and we've gone through a great deal of paper towels and soap and things like that. So just need to do a transfer out of building maintenance where there's some additional funds that weren't used into the janitorial line where we hit quite heavily.
Any questions?
Patsy will move that.
Pat, second.
Sterling.
Sterling, all in favor?
Aye.
Opposed? So carried. Thank you, Bob.
And I thank you, and that is something that I worked out with the controller, and Ron did sign off on that. And with that, that's all I have, and I thank the committee for their patience.
So I have a question, Bob.
Sure.
So the Galvin questions that I had, Bob and Rob, these are ongoing, and we're still waiting for some answers?
We
Yeah.
are waiting for
Go ahead. We haven't
that
had
is correct.
meeting, though, Linda. I wanted to sit down with Bob and discuss this further. We had a preliminary discussion about it. I did get the contract. I forwarded it on to you, Linda, as well. So we have not taken the next step. And I know Bob is working on it behind the scenes, but I have not been involved in anything as of yet. Go ahead, Bob.
I think that sums it up. I think that those are concerns that we were raising on our part. So, to hear those concerns come up from the board made perfect sense to me. And it's something that, it's a good time to address it because programmatically I'm making some changes. And I think that we do want to talk about the facilities and we want to talk about some of those things that were going to help us out programmatically to make sure that they're going to be put into place and sooner rather than later.
Okay, thank you.
Yeah,
Thank you.
I have concerns about that too, because I've heard that maybe they aren't living up to their contract. We worked so hard in the beginning for so many clarifications on what exactly they were going to do. So I'm kind of interested in what you find out as to what they are or aren't doing now.
Oh, absolutely. And I welcome participation from any supervisor for sure. And we'll certainly keep the committee apprised on that. But yeah, I guess we looked at it this way. We need these things to be up and running as we thought to really make the kind of progress we wanted to. We understand that we dealt with a pandemic right in the middle of things, so I didn't want to be unreasonable, but we feel like the time has come to really to drill down on some of this and further the discussion and see what we can't get done in the near term now so that we can start to move forward.
Thanks.
Thank you.
Okay. What do we have here, Kelly?
Office for the Aging.
Kevin? Got to turn your mute off, Kevin. There
Okay.
you go.
All right. Thank you. First resolution is to request permission for our agency to contract with the City of Hudson Fire Department for a period not to exceed 3 years to provide a facility for the Office for the Aging to provide a congregate meal site and related programming for seniors at a rate of $400 per month.
Yeah, I have a question about that, Mr.
Sure.
So why is it, what's the reason for moving out of the libraries? Because it's closed or is
Well,
it too small? Or can you
it's
explain?
a number of things. The too small is probably the key agent. In the past, we have had some problems with the parking. There's not much parking for the seniors. And just recently they put some handicap parking in, but it's still not enough for what we need. It's being up on the second floor, I don't think is really a good thing for our seniors. We've always been concerned if there's ever a problem with the elevators, and we have had some problems in the past. But we solved them. But it's just the fact of being up there. And just recently, we were informed that we're going to be moved from the larger room to the smaller room. And I just don't think with COVID I don't think it would work. So, like I said, we reached out to the fire department. They've been very gracious to accept us, and they have a huge room up there. And I just think it would be, there's plenty of parking. It's all on the first floor. I think it'd be an excellent move for us to make.
Thank you. Were you paying were you contributing to the City of Hudson for this?
No.
So this is an additional expense for your.
Yes. We actually had it budgeted for this year because of the parking situation, but we just never made the move. So it was in this year's budget, but we didn't use it.
So it's gone through finance?
Pardon me?
It's gone through finance?
It will
Yes.
go through finance.
Finance.
It will go through, okay.
One more question. How many people go to that? If you have an idea.
It varies, Linda. On Monday, Wednesdays, and Fridays, we get probably 10 to 12 people. And on Tuesdays and Thursdays, we get close to 20 people. I think a lot of it is due to the programming that they do up there on Tuesdays and Thursdays. They have special bingo games and other types of things, and it just attracts more people.
So that's not moving with you, right?
Yes,
Bingo?
it's our program. Yes,
Oh, I didn't know you did bingo.
yes, we do bingo usually once a month, also known as Pochino. That's another name for it. They do that on the other 3 days.
Okay, thanks a lot. Take care.
You're welcome.
Are there any other questions? Can I have a motion?
Fury will move it. Second, Morel.
Second, Morel. All in favor?
Aye.
Aye. Opposed?
Aye.
All right.
Okay, my second resolution, it's similar to the first one. As far as to contract with St. Luke's Lutheran Church in Valatia for the same period, 3 years, to provide congregate meals and related program up there at $250 per month. And Supervisor Leader is probably aware of this. I know she steered me in this direction, trying to find another location. What we have been up in Valatia at their senior center. That's where we've been with this program. There's no way with COVID trying to keep the appropriate distancing that we'd be able to return there. It's just too small. So we found a church that's on the, again, and that's the same problem we had up in Valatia was with parking also. So this worked out that, if we can go to this place, it's plenty of room, and we're hoping to start attracting more people there.
Kevin, how do you come up with these rental amounts? Is it just basically what they're asking, or?
Yeah, we usually sit down with them and negotiate or try, and again, this is only for 2 days a week. Okay. We're only up in Valatia 2 days a week. City of Hudson's 5 days a week.
Okay.
A question, Kevin, when will you be starting these programs up? Is it anytime soon?
Yeah, actually Hudson, we're hoping once we get the contract signed and in place, I think we're shooting for October 1st, and probably the same thing with the Valatia site, October 1st. But if we don't have everything ready, we will not open. We want to make sure that we've got all our protocols and COVID procedures all in place. We have opened the one in Livingston. We opened that last week for 2 days a week, and knock on wood, everything's going very, very, very smooth. The seniors have really, really missed these programs. We've gotten countless phone calls from, ranging from different areas of depression and loneliness. Just sometimes these programs are the only things that they have to look forward to. So we're really happy about trying to start reopening again.
I'm going to move this because I think it's the best thing we could be doing right now, especially up here. It's a great facility to have this at. And I know the seniors up here in my area and around here are excited about it and looking forward to getting back together again.
Fury will
Yes.
I'm
second
going to
it.
move it.
I second it.
Fury, second on, all in favor?
Aye.
Aye. Opposed? Carried.
Okay. My third resolution is request permission to accept a grant from the State Office for the Aging in the amount of $14,828 to amend the New York Connects account. It's a wash. It'll amend the expense account and the income account. I sent this through Ron Campanero, our controller. It's money. It's additional money that they're giving us for COVID-19 related expenses. We contract with the healthcare consortium to run this program, and state's giving us more money, and we're going to give that to them to run the programs.
I'll make the motion.
I make the second.
Abdus, all in favor?
Aye.
Aye. Opposed? So carried.
Okay. And my final resolution is permission to promote 2 community service assistant positions to case manager positions. One of the case manager positions is currently vacant. It's been vacant since February of this year, February or March of this year, due to a retirement. And at the same time, like I said, it'll end up saving the county approximately $23,000 because our intent is to not backfill the community service positions. And upon successful completion of civil service exams, we would then move to eliminate these positions. So in actuality, and then at the same point, we wouldn't be hiring somebody from the outside as far as benefits goes.
Can I ask, has this gone through budget and position control?
Yeah, yes, it has.
All right, then I'll make the motion.
Second,
Seconded. Second.
all in favor?
Aye.
Aye.
Opposed? So carried. Thank you.
That's all I have. Thank you, Supervisor.
Thank you. Public health?
Okay. Hey, Jack.
Jack?
Okay, I'm with you. You hear me?
Yes.
Okay. I think I don't know that we're moving forward on this one.
No, we're not. It's got to go through committee first.
Okay, yeah, so we're setting that one aside. Okay, this is what was discussed the other day. We were getting a grant from the state, $266,000 for 2 years. It's through the CDC to enhance our ability to do contact tracing and also implement the ComCare program for the tracing. It is required that we hire new. We can't use it to fill existing, pay for existing positions. We're looking at hiring an RN to do this, coordinate our activity in ComCare. Because it's a 2-year grant, it's kind of timing perfect because I've got retirements coming up in the next 2 years in my nursing corps. And this is somebody that we could bring in here under a grant and slide them right into a regular nursing position. So looking for permission to fill that.
I'll make the motion.
Linda, second. Supervisor Mussman first, sorry.
Yuri?
Supervisor Beery, second. All in favor?
Aye.
Aye.
Opposed? So carried.
Jack, could you explain to the committee that once this grant is up, the transition?
Yeah, as I just mentioned, I have up to 3 RNs who are talking about retiring in the next couple of years, and 1 definitively doing it, and 2. And so by bringing this person in now under a grant, we're not creating a position that we have to live with in the future because we can, they can just fill due to retirement down the road. So this is the other part of the $133,000 in a year. This is essentially a COVID data entry clerk. There's a lot of work back there when it comes to putting in all the contact tracing. I have somebody currently in a clerk typist position who is going to be continuing on in college as an epidemiologist and/or going to med school. She's kind of undecided at this point. She's absolutely incredible in terms of computer stuff and all of this work. What I want to do is move her into this position so that she can help us out for the next 2 years. In 2 years, she'll be hopefully going to medical school. I think that she's going to be a great candidate. And in the meantime, after I move her into this COVID clerk position, I want to backfill the clerk typist position that she's been sitting in. It's a part-time position. Both of these are part-time. We have been asked by the state health department to practice our point of distribution or PODs in anticipation of us doing mass COVID vaccines in the near future. They want us to do it with our flu. So we're going to organize some pods out there, and we are required to collect insurance in order to do this. And this clerk typist person would be critical to helping collect that, registering people and collecting that insurance.
I'll move it. Yuri?
Second.
Second.
Patsy.
Supervisor Leader, all in favor?
Aye.
Aye.
Opposed? So carried.
I believe this is just the authorization to accept the $266,000 from the State Health Department.
We need to get that one done for sure. I'll move that.
Second.
I'm seconded.
Supervisor Mia, all in favor?
Aye.
Aye.
Opposed? So carried.
Okay, so this is something that we had discussed, a ways back, but we find that the State Health Department is making available through NICEHO, the organization that I belong to as a director, a small grant of approximately $8,000 to enhance our ability to reach special needs populations when it comes to COVID testing. This proposes to use that funding. It's not mentioned in the text because it hasn't been awarded yet. But to use that funding to subcontract out with EMS individuals, paramedics and EMTs to help do the testing in some of our on some of our farms. We've done a couple already, and on some of our farms, group homes, any place where individuals have a hard time getting out, we can actually take the testing directly to them. And so it's $150 per member per clinic, and I don't propose to spend any more than the $8,000 that's coming down through the grant. So this would be budget neutral.
Any questions?
I'll make the motion.
Supervisor Mussman, second.
Sterling, second.
All in favor?
Aye.
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 So carried.
So there's the report. Anybody has any questions for me? 529 cases as of this afternoon. We received a call about an hour or so ago from the Sheriff's Department looking for a kit because an inmate was brought in and on no bail, so it's a pretty decent offense what he committed. He was telling the trooper on the way in that his mother was positive for COVID, and at the jail he was found to have 103 temperature. This is what our days are like. It's just it's one thing after another. So, but I'll answer any questions on the report.
Any questions for Mr. Mann?
It's Jess Nabosny from the Youth Bureau. I've had quite a few inquiries from municipalities just wondering about when they can open their parks. I know the city of Hudson is the only municipality that's running programs. They don't want to run programs. They just want to know like what they can do with their parks. Mainly Chatham has called. So I have referred them to the health department because I don't have any insight from the state or from the Association of New York State Youth Bureaus.
Well, at this point, I believe they do have the authority to open them. I understand their hesitancy. The issues are going to be, depending upon the park itself and what they have there, you can't socially distance playing soccer or playing basketball. It just doesn't happen. I think that if they develop a plan for swings and playground areas and whatever, we did have a call from, I'm not sure what town it was, asking for information that we passed on to Kaylee Nito. She's here. She's the one who's handling these calls. If you want to email her at her county email address, you can send those folks right on to Kaylee.
Yeah. They were worried about liability. And I said, I think you have to talk to your municipality's attorney or whatever. Because there's liability there too. You can't put signs up that say, come in at your own risk or whatever. I don't know.
Well, I think the issue is going to be from the liability point of view. I don't know how you prove that anybody who went to a park got the virus there.
Right.
When there's so many places that, and I do agree with you. I think that the stop is to talk to their attorney.
Right.
I don't see where they can really get sued for that. As long as their due diligence is to put up signs, encouraging social distancing, and do use masks when you feel like you're going to be in close proximity and whatever. And certainly some way they can find to block, basketball, soccer, those kind of activities, because you just can't socially distance them.
Yeah, and Chatham, it was actually Henry Schwartz, who works for emergency management. He was the one that contacted me and said, we have put the, I don't know what you call them, the snow fences up or the whatever around the equipment there so that people couldn't do that, but they're still allowed in to use like the picnic tables and things like that. And I know that's what Chairman Morrell did out in Stockport too, I think he said to me. But yeah, I don't know how you do the signage and things like that.
In Stockport, we voted at our last board meeting last week to keep the park closed till the end of the year.
Okay.
So,
All right. Yeah, and I think Supervisor Eldridge did that too, I think in Greenport.
Greenport's still closed, yeah.
There's a petition going around that all supervisors should open up their playgrounds and parks. I don't know if you're aware of it, but I've already been, this is Patsy, by the way. I've already been hit on a couple times. The thing is that my trouble is basketball. I'm having a big problem. I closed down the playground area in my big park, the small park I opened up. I've had baseball playing there and so forth. My biggest problem is the garbage. So now I put up a sign that I think would put hair on the back of your neck. And so they better take it out. Otherwise I close it down again. And I got Jersey barriers to keep it closed. So the trouble is people have been even breaking the snow fence and so forth.
Is that through, is that at Rothermel?
No, it's Volunteers Park. State Farm Road.
Okay. Oh, yeah, that's the big one. That's the big one. Yeah.
My big park. Rothermel has nothing to do with that village.
That's what you can't do. I don't know how. I mean, even the city of Hudson has just said like they have trouble. They're doing a great job, but you can't keep people out of there when it's after hours, and that's the problem. And who's responsible for that? Who's liable for that? Is it the city or whoever? Like, is it the municipality? I don't know. You have to talk to the attorneys, I guess, right?
That's the first stop.
Well, my problem is that we can open up our parks, the governor said. It was our own risk. But then people took advantage of it and disrespected your property, and it's their property too, but they just disrespected it. So that is the biggest issue I have, is no respect and so forth. I do have extra law enforcement now patrolling it.
Yeah.
And like I said, I would close it down in a heartbeat.
Yeah.
I'm not doing soccer though, because I have 400 kids that do soccer, and I'm not doing soccer.
Yeah, but I worry about the swimming and who's responsible for that. And I know it's not all of your responsibility, but I just wondered like what other municipalities were doing, because it's a big concern, like, with Chatham and down in Copac and I'm trying to think, Art Bassin in I can't even remember now, Ankrum. Like swimming and things like that, like it's a problem.
Yeah. Yep.
So I don't know. I just wondered what other people were thinking and who's reliable or, responsible if something happens and somebody drowns or whatever.
Do you think that there's value in having one of these virtual calls with all the people that head up these parks to decide to talk about it, and maybe Rob Fitzsimmons can talk about the liability sort of in a global way?
Yeah, because I think that it would go on the county, not sometimes it's the municipality, but you can talk to your attorneys and see. But I think like the county might be liable in some way. I don't know.
Well, if somebody drowns in any pool or natural body of water that's controlled by a town, they're going to get sued. I mean, that has nothing to do with COVID. I think I think the issue is, for me, is you really can't track back where you got COVID for the most part.
I don't even think about COVID. I think about, can you put signage up that says swim at your own risk? The state says, no, you can't do that anymore.
Yeah, it's a legal question for sure.
I think we need to have a discussion with the county attorney. We're not going to solve it right now.
Yeah.
So,
Okay, thank you.
yep.
Any other questions for Jack?
Yeah, I have a question, Supervisor Shimidas.
Go ahead.
Jack, can you talk a little bit more about the testing that's going on at the jail? You had mentioned sort of just doing a test today, but what's the sort of general protocol that's been going on?
They test any inmate that comes in there. This is not unusual for them, and they do have a few kits. What they asked us for was the packing material that it goes with. So they do test every inmate that comes in there if they're incarcerated, and they're pretty tight over there. They have pretty tight control over things.
Okay, thanks.
Jack, there's been a couple of other questions that have come through that I've asked Kelly to forward to you in an email. If you could please answer them, I would appreciate it. Any other questions for Jack? Thank you, Jack.
Okay, thank you.
Human Services?
Okay, good afternoon, everybody. This is Dan Almasi. I'd like to thank the Chairman Matt Morrell, Rob Lagonia, and all of the members of the Health and Human Services Home Committee for, I guess, allowing me the opportunity to be the interim Director of Community Services. I've been on a few calls with all of you, but maybe not all of you that are in the audience on this call, so I just wanted to start by saying that. I see that the first resolution that we have in front of us has to do with Twin County Recovery Services and some existing agreements that we've had. What's happening here is basically there are some changes that have gone on, one of which has to do with the jail, and another has to do with an existing position. So due primarily to the bail reform, there's been a reduction in the need for this particular position at the jail. So Twin Counties has opted to not fill that position. That position has been vacated, so they've opted not to fill that position. And the other position, I believe they have found some other funding. So where that's left us is that there has been a $67,000 roughly in state aid that will not be going to Twin Counties, and then there'll be a savings to the county of some $82,000 in tax levy funding, totaling $150,000+. Any question about this resolution?
Any questions?
Fury will move it.
Second, Sterling.
Second, Sterling. All in favor?
Aye.
Aye.
Opposed? So carried.
Thank you. Second resolution has to do with backfilling a behavioral health care coordinator position. The adult behavioral health care coordination program at this point is working beyond their capacity, so they're very much in need of help. The nuance here is that prior to COVID, on or about late February or March, a staff person from the care coordination program expressed an interest to come to the clinic and fill a vacancy that the clinic had. That was supported at that time, but the move was not able to be supported because due to the hiring freeze, as well as the needs of the care coordination program, that employee remained there. So she is now in a position to be able to move over to the clinic. So we would like to backfill her position as a behavioral health care coordinator in the adult care coordination program.
Any questions?
This went through budget and position control?
Yes.
Motion, Sterling.
Second?
Second, Mussman.
All in favor?
Aye.
Aye.
Opposed? So carried.
Thank you. And so, in addition to the staff person that I just mentioned, who's making the transition from the behavioral health care coordinator coordination program, to the clinic, at this time, our needs go beyond that. So we're asking for permission to do an additional filling of a vacant position. Now we have 2 titles listed here, and I'll explain why. So the 2 titles are behavioral health social worker, which the requirements for that are having a licensed master's level in social work degree. The other title is the senior behavioral health social worker. That title demands that a licensed clinical social worker fill that position. Ideally, we would like to fill the senior behavioral health social worker with a licensed clinical social worker. The reasoning behind that is, for example, Medicare only allows clients to be seen by LCSWs, and we have a significant number of people whose primary insurance is Medicare. Also, some of the vacancies that we have within the department, our clinical vacancies, were LCSWs leaving us. So it's important for us to be able to replace those LCSWs. So we're aiming to find a senior behavioral health social work candidate, but if for some reason we cannot, we would like the opportunity to pursue the behavioral health social worker so that we can get some assistance for other initiatives that we'd like to pursue within the clinic mental health center.
This also went through budget.
Yeah, I think it's a good step. Yeah, I'll make that motion.
All right.
Okay.
Seconded.
Supervisor Mia?
Yeah, seconded.
All in favor?
Aye.
Opposed? So carried.
And I believe this is the final resolution, has to do with contracting with soon-to-be former Director of Community Services, Michael Cole. I had asked, when I was asked to take on the interim Director of Community Services role, for the opportunity, the ability to consult with Michael Cole. I'm very excited to serve in the capacity of interim. However, there are areas of the Director of Community Services role that I am not as familiar with. So in an attempt to serve the community, the county, and the Department of Human Services the best that I can, I asked for the ability to consult with Michael Cole. And you'll see the parameters there. It's for 6 months. It's at a rate of $100 an hour. And I believe it's not to exceed $1,000 per month. So I don't expect to be on the phone with him, daily, but when instances come up, I would greatly appreciate the ability to reach out to him and get his expertise and consultation.
I'll move that.
Thank you.
Second.
Mussman, second.
Okay.
All in favor?
Aye.
Aye. Opposed?
Okay, and then I believe finally we see the overtime report. As you can see, through July, we've used just hardly any of the overtime that we budgeted for. It comes in at $693, give or take.
Any questions? Michael, I want to personally thank you for your service to the county, and I want to wish you good luck. I'm sure I will say that more either in person or again, but I wanted to say that while the committee's here, and I didn't get to work with you that long, but I've enjoyed it and I've appreciated your professionalism. So thank you.
You're very welcome. Thank you for the opportunity to serve our community. It's been a very challenging and stimulating capstone to my career. But what a privilege. Thank you.
I second that, Michael. You've been a big help to me in working with some of the clients that have needed help, and you were always there when I needed you. Thank you.
Michael, thank you. As you serve with us and our community. So thank you for your services. Thanks.
Most welcome.
Thank you, Michael. I know we've tried your patience a lot,
And I yours.
to say the least, but thank you. Thank you.
Thanks, Mike.
Thanks, Kathy.
Hey, Dan,
Yes.
you had one more thing. I don't know if you want to bring it up, the Valatia lease
Oh,
On your-
okay.
on your agenda.
It's on the agenda, but I don't think I have the packet.
Okay,
Joe,
I didn't know if it was left over from last month or,
Yeah,
do you want,
I'm not sure. This is kind of a carryover. We have not seen clients right now in Valatia, and I think we still have a lease, and I'm not 100% sure if it needs to be discussed here, but I think I kept it on there as a reminder, and I don't know if Michael had anything to add, but we're gonna eventually have to make a decision on when to start seeing clients again and that kind of thing.
I think we'll have to have a discussion on this, Dan, Joe, outside of this, because just to get us up to speed, and then we can bring it to the committee.
okay,
Sounds
good idea.
Anything else anybody wants to bring up? If not, I'll entertain a motion we have nobody else, right, Kelly?
you just had the questions from the public, which you said, Jack will address?
Correct.
Yeah.
Okay.
Okay.
Should we,
ahead.
Chairman, should we forward those questions to the committee, just so they know what they are?
Yes, Kelly, can you do that, please?
Forward it to the committee?
Please, as well as.
Sure.
Thank you.
Yeah, the
Thank
chairman
you.
was breaking up, so I couldn't understand what he was saying.
Not a problem. I'll entertain a
Tom.
motion to adjourn.
I'll second it, Patsy.
All in favor?
Aye.
Aye. Thank you, everyone, and welcome, Dan.
Okay, thank you, Rob.
Thanks,
Thank you,
Dan.
everybody.
What
Appreciate it.
what's